We're down here in Melbourne in Etihad Stadium. We're here for the ACTU 2015 Congress.
It's a place where we come to meet all the other unionists. We get to make policy, we get to vote on resolutions.
So it's a really big event. Look, it's been really good so far. This morning we handed out flyers. We were holding a fringe event at lunchtime and talking about the attack of Abbottcare on Medicare. And so we distributed a lot of flyers this morning at the front gate.
I'll be making a squealing out of this one.
We had a really good street theatre event leading up to the morning tea session.
We had lovely Uncle Sam all dressed up in his cap, and then we had Dr. Abbott, who was Uncle Sam's best friend.
You're being treated to a rare surgical procedure. We've got Dr. Abbott, the surgeon specialist of Razor Gang Inc. Here to do real-life surgery on a patient, Mr. Economy. Dr. Abbott's best friend, private health insurance, has joined the procedure as well. Maybe he just wants to make the patient more comfortable.
Your private health insurance doesn't seem to cover anesthesiology. Don't worry, Mr. Economy. I'm told it's relatively painless and it'll be over before you know it.
Deep cuts to our universal health system.
People came out, we ended up with a really big group around us, and they were very interested and quite amused by what was going on, but I think we were able to get our message across as well.
So that was good fun. And it was an advertisement for our Medicare forum that we held.
Medicare is an Australian success story. We should never forget that.
The fact is that we can't understand what they're doing this year around the budget and around Medicare without understanding the response that we generated to what they did last year. You know, the co-payment was one tool to do their agenda for Medicare. They've now gone into Plan B or Plan C, which is about the rebate freeze. That's the major tool that they now have against Medicare.
We spoke about the impact on frontline nursing staff. We see patients presenting later because they can't go to the GP because the GP is not bulk billing them anymore. We'll see our EDs overwhelmed as they're forced to become de facto GP services because of this government's actions. Nurses and midwives will not go quietly and allow universal health care to be destroyed.
And there's one thing that people will rally around, it is Medicare, and we will continue to fight it, and we've got the people's voice to do it.
Let's all stay strong and save our universal healthcare system against any attack.
We will fight to improve society for Australians all around. And this morning we've had the really exciting launch of the ACTU campaign, Building a Better Future.
Brett Holmes was very good in moving the motion to support the ACTU Charter that we also adopted at Committee of Delegates around protecting Medicare.
We want a fair go for all, and we will do everything in our power to defend our living standards. As frontline health professionals, we feel strongly about our universal health system. It should not be undermined by any government. We demand that the federal government keep Medicare universal, keep Medicare fully funded, and keep it public.
It was very well received, and I thought it was a very important move for the nurses and midwives of New South Wales and Australia.
We're going to try and fight to make sure that Abbott doesn't demolish what is one of the best healthcare systems in the world.
We will continue to advocate on behalf of our patients. We will rage against the rise of Abbottcare, and we will fight until Medicare prevails.